Hi everyone, welcome back. My name is Hina Mazarudin and I am your Vice President for PAs in Virtual Medicine and Telemedicine. Today I'd like to continue a series of where we highlight some of our amazing PA members and how they work in their respective fields and utilize telemedicine. My intention is that this serve as an opportunity for us to connect and network together and also to highlight our amazing members. You know I believe that we are stronger together. So without further ado, let's get started. Hi everyone, welcome back. Thanks so much for joining us. Today I'd like to introduce you to another amazing PA. Her name is Stephanie. She is a bilingual certified PA who specializes in primary care for women with a focus on well woman exams, family planning, and prenatal care. She has utilized telemedicine in her OBGYN practice and is now a first assist as a surgical PA. Welcome Stephanie, how are you?
I'm doing well, thank you. Thank you for having me. I love what you're doing and I'm happy to collaborate.
Thanks so much. All right, Stephanie, can you start off by stating your name, how long you've been a PA for, the area of medicine that you're practicing in, specifically utilizing telemedicine, please?
Sure. So my name's Stephanie Ochoa. I've been OBGYN since graduation, and we've recently started incorporating telemed. So I'm excited to tell you all about it.
Awesome. Well, tell me more. How do you utilize telemedicine as an OBGYN PA, please?
So we really stick to the GYN part. As a practice, we thought that maybe OB patients wouldn't be ideal just because we really want to get those vitals and make sure that they're accurate for the blood pressure, especially women in the second and third trimester. And then it's always very important for me to actually hear the fetal heart rate. So we do use mainly telemed for GYN visits, such as birth control refills or consults, maybe some UTIs. There's some patients that know exactly what they have, maybe if they've been battling recurrent BV or recurrent yeast infections. Typically I'll feel comfortable with seeing those type of patients, and then just making sure I tell them that if there's no improvement, to just make an appointment in person for a follow-up. Cultures are always ideal in the GYN world.
Absolutely. So it sounds like it's a great way for you to connect with your patients, to take care of some of the more common things, and also refills, like you mentioned, with whether it's contraceptives or anything that they may need, any medication refills, something that's a little bit more straightforward. To doing even something a little bit more complex, but having them come in if needed, like you said, to do some cultures or something if it's not improving.
Correct.
Awesome. So tell me what you like about telemedicine and what you find to be a little bit of a challenge, please.
So what I like is that we can offer similar services at the comfort of their own home, and those patients that maybe have problems with transportation or have difficulty with follow-ups, and maybe those appointments, one I didn't mention was maybe results like pelvic ultrasound results. That's something that we can perfectly discuss over the phone or video phone call. And so I think that it's really have that continue the patient care with telemed. What I don't like is that when you're ready for the visit, they're not connected, or there could be internet issues. And so sometimes when you mix in your telemed visits with your actual in-person visits, it can get a little tricky as far as schedule. But aside from that, I think it's great, and I'm really looking forward into implementing that in the future.
Absolutely. You mentioned a great point, which was about how it can sometimes be a little bit hectic if you're trying to mix a telemed visit and then do an in-person and then telemed and in-person. Do you find that it works better if you block schedule or you set off certain days that you do it? How does it work in your practice?
Yeah, I think so. And that's what we ended up doing. So we dedicate the first hour for telemed and then the last hour for telemed. And that's been working a lot better, because going back and forth, it's just too much, even for the staff, for the check-in and the MAs to make sure that everything is ready. It just makes more sense to have time blocked out for telemed visits.
Absolutely. Stephanie, if you could share with us some words of wisdom, a clinical pearl, something with our PAs and our fellow PA students, please.
Sure. I've been thinking about this question all day, and there's so many things that come to mind because there's so much that I would like to say. But I think I'll go with being patient, and being patient as a student when you first start practicing, your family at home after a long, stressful day, and just constantly reminding yourself that as PAs, we are very well trained to adapt to different situations. And although most of us are humble, sometimes we have too much responsibility. But again, going back to patience, if you go in patient, you're nice to everyone, treat everyone like you would like to be treated yourself, or treat your patients how you would treat your family and your friends, I think that you will be very successful.
Absolutely. Thank you so much. And Stephanie, I have a little bonus question for you because you do something really special on the side, which is you do a all Spanish podcast going over various different health conditions. Can you tell us a little bit more about that? And hopefully it's a tool that you share with your patients for telemedicine on the different topics that you've had, that you've done so far. Tell us a bit more, please.
Yeah, of course. So it's called Cuida-T Más. It is all Spanish, and I have not used it as a resource for my patients because we're only 10 episodes in. We're very new to this, but that is a great idea because I do talk about a lot of women health topics. And yeah, we focus on public health. And if there's anyone that's interested and wants to participate and be a guest, please contact us. We're on Facebook, Instagram, Apple Podcasts. You can find us anywhere.
Thank you so much for sharing that. I'll put your link at the bottom if anybody wants to reach out to Stephanie and contribute to that as well. All right, everyone.
Thank you
Thanks.
so much.
Thank you, Stephanie, for joining us. Thanks, everyone, for joining us and watching, and we'll connect with you soon. Take care. Bye.
Bye.